Well, over the past several weeks, Newsfirst has been closely monitoring how the coronavirus across the globe has developed. And we now cross over to Newsfirst. Shami Russell, he's standing by with a special guest to give us analysis on how the situation is progressing in the future.
Thank you very much, Shaheen. A 15-minute test has been introduced by the US government to detect those infected with COVID-19. How far is this successful? Joining me this evening on the show is Dr. Jadwan Bandara, Director of the Medical Research Institute, to discuss all this and more. Stay connected, stay with Newsfirst. We will join you right now. Good evening, Dr. Jadwan Bandara, and thank you very much for joining us once again on the show. After yesterday's death was reported, people have started worrying, and this is very natural, Dr. Bandara. How can you differentiate from a normal cold, a normal sore throat, for that being infected with COVID-19? How can you differentiate?
Actually, this is depending on the knowing of the contact history. It is about 16 days after the curfew and the school holidays. If you have been at home during all these 16 days, it's very rare you to get COVID-19 infection into your body. But one of your family member has gone out and behaved unsafely. That means not maintaining 1 meter distance and being with social gathering or in unsafe places. So then that family has to be a little cautious.
Dr. Bandara, when you take a look at the curfew and what transpired in the last few days, there is a threat of someone being infected because there was no social distance maintained. So when must an individual meet his or her physician?
Well, these symptoms of COVID-19 infection is little severe than the normal cough and cold. But it start with little sore throat and nasal block, and maybe little runny nose, headache, maybe lethargy, little fever. So that is the start of. So then if you have been out of house and if you are not happy with your social gathering, so you have to be at home in your own place with your own utensils, maybe the towels or the bed and linen, all those things has to be keep with you only. And if you are using your bathroom, so let the other people to use the bathroom and you have to go at last. And before you are coming out, you have to clean your bathroom very well and come out. And be home quarantine for a few days and see whether your sore throat or whatever it is worsening. So if it is worsening and if you feel difficulty of breathing and the fever is not coming down, and if you feel that it's aggravating, so of course you have to be suspicious, because now we suspect, not yet proven, we suspect now the COVID-19 has started to go into the society because of the unsafe manner of some people's behavior.
Dr. Bandara, now the problem is, can you go to a private hospital and do the test required?
Of course, yes. Government, the Ministry of Health has allowed private hospitals which are registered under the Ministry of Health to perform this test. But it has to be under a consultant virologist, and it has to be tested and certified by consultant virologist, and the patient has to be admitted to the hospital. Those are the main criteria to take this this test from a private hospital.
So we saw recently, Dr. Bandara, one of the private hospitals in Colombo, which had a patient infected with COVID-19. They did carry out the test, and the patient was transferred to IDH as a result of him being a positive case for COVID-19. Yeah. So there is always a possibility for the patient to be transferred to IDH.
Of course, yes. The COVID-19 infected patients, the current recommendation is to treat in government hospitals which are, dedicated for this management of these patients.
Dr. Bandara, right now the FDA of the United States government has introduced a 15-minute test to detect those individuals who are infected with COVID-19. Has a program of that sort in place in Sri Lanka?
Well, it has to be decided by the technically qualified people and the people who take the responsibility of doing this test in Sri Lanka. So, what the scientific understanding is this short time testing, I mean the test that you were talking about. So, this is for antigen and antibody testing of the body. So, when somebody get infection, they can develop antigen and antibody. It takes about 3 to 5 days. The problem is the sensitivity and specificity of this test. If somebody is positive and this test is giving negative, that means false positive, false negative report will come.
Dr. Bandara, let's say someone is suspicious of being exposed to the outside environment. Can he or she go to the Medical Research Institute and do a test?
No, government clearly said, because Medical Research Institute is an institute where the test being performed. But the sample collection not been happening there because we don't have that facility, we have not developed this facility. So, patient has to go to either nominated private hospital or registered private hospital or nominated government hospital, and from the hospital, according to the clinical background and contact history, they will be admitted to the hospital. Then only they will take the sample and send it to MRI. If it is from private hospitals or private sector, the government will charge about 6,000 rupees. If that sample comes from either army hospital or government or semi-government hospital, so there won't be any charge imposed.
So how long does the MRI take to release the results of a
so I must
PCR
remind
examination?
Yes, it takes about 6 hours minimum in Sri Lanka, which has been taken more than 10 hours in other developed countries as well. So there is a very good team with me, including consultant virologists and medical officers and medical laboratory technologists. I must remind their names: Mr. Gayan, Priyantha, Nadisha, Udara, Chandima, Magadi, Jinadari, Sanduni, Lakmini, Darshak, because they are the people who are handling first this test being done, and other people are laboratory assistants and the healthcare assistant. Those people are doing wonderful work, and this takes about 6 hours minimum, and the test is called PCR, that is polymerase chain reaction, which gives 100% result.
Dr. Bandara, I'm with numbers, guys, so I want to talk a little bit about the numbers with regard to those infected with COVID-19. Let's take the numbers the world over. You have 683,694 patients infected with COVID-19, and the number of recovered stands at 146,396. In a percentage, it stands at 21.4%. Now let's take a look at Sri Lanka. The number of infected persons stand at 117. The number of those recovered stands at 11. In a percentage, it's 9.4% success rate. So overall, it seems that Sri Lanka is not successful yet.
No, not at all. I should deny, because we started to find out these patients, the increasing number of these patients very recently. From 11th of this month, we found several patients. Now it has come to up to 113, but maybe about 9 patients has been discharged, 1 patient died, and yet to be recovered from the infection by developing self-immunity. So only we have 1 death, even though we have 113 cases.
170 cases so far.
Okay. So the thing is, so the recovery is a self activity inside the body. So inside the body, the immunity system has to get rid of this infection from the infected people. It takes time. Even for this Chinese lady, it took about 26 days. And our first patient was discharged within 12 days after recovery, after admitting. So it takes time. But our system is, they are doing very fantastic job.
So my final question to you,
people can, without any fear, trust these treatment methodologies.
My final question to you, doctor, for this evening is, you have a quarantine period of 14 days.
Yeah.
However, the first patient, as you correctly pointed out, was released from IDH in a span of 12 days.
Yes.
How did this happen?
Well, this patient presented to the hospital very late. According to his, I must talk about this. According to his, declarations, he has been to many private places with severe cough, sore throat and respiratory problems for several days. Maybe about after 10-15 days later, he has been admitted to the hospital. That is the danger the society has to be aware of, because the people with symptoms and signs and with the infection may have been in the society. The people who got the infection from those people will develop symptoms and signs maybe about within the next couple of weeks. So it is a danger point, because still without knowing anyone there may be infected people in the society. Even themselves they may not be aware of this thing.
Right,
so that is the danger of the country.
Thank you very much, Dr. Jaruam Bandara, Director of the Medical Research Institute in Sri Lanka, for joining us this evening. Thank you for being in the front line to treat those infected with COVID-19. I know that most of you and your staff are putting their life at risk to do the test as far as Sri Lanka is concerned. Thank you very much, Doctor, once again for joining us this evening on the show. Safety is not a gadget, it's a state of mind. The safety of the people shall be the highest law. Stay connected, stay with News First. We'll go in for a short commercial break, and on the other side we will have Shahin anchoring the news.